I was in Cleveland in March of 2007 giving a speech at a luncheon, and Connie was there. It was a very nice event. Afterwards, a number of people spoke to me. One woman who was very well dressed leaned over, spoke to me, and said, whispered in my ear, she didn't want anyone to hear, whispered in my ear that she had a lump in her breast. And she was really afraid for herself and for her children because she had no health insurance and therefore could not get it tested. But I want to talk today about the fact that it doesn't matter what kind of services we have if we don't have access to them. And the impediments to access are on whether or not, or some of them, whether or not we have insurance. Some of them are demographic, our economic status. Some of them are geographic. If we live in rural areas, it's more difficult for us to get services. And these are things that need to be addressed. I want to make 3 points with my testimony today. One is that health insurance matters. The quality of coverage, of course, matters, but health insurance itself is really a crucial part of this. Probably the most preventable cause of unnecessary suffering in our healthcare system is the lack of adequate health insurance. That was what this woman was complaining to me about. Compared to those with health insurance, uninsured people with cancer are more likely to be diagnosed late, less likely to have access to needed care, and more likely to die within the 5-year period. They're also less likely to have their lives prolonged. It's likely to be tied to the ability to get access, both demographically and geographically. But if you're, as Senator Brown was mentioning, these disparities, if you're a black woman today, we've made all this progress that we've been talking about, which is great. But if you're a black woman in 1988, your chances of survival are essentially the same as they are today if you have advanced breast cancer. They haven't changed in 20 years. Now, if you're a white woman, they have changed. Your chance of living about 2 years longer because of the improvements that have been made because of the research. But these are not available widely. There are, of course, right and wrong ways to insure us. It was really important that we build, I think, and I hope that your programs will build on an existing successful system of employer-based coverage until we're able to subsidize everybody. And I hope there would be a someday when we're able to do that. But until we do, what has worked for us is an employer-based system, and we need to make certain that that remains in place, because people who are uninsured, 47 million of us are uninsured, another 15 million or so who are underinsured, are largely uninsured because we don't have coverage through our employer. If you, among those 47 million who are uninsured, 1 million have cancer, and that's the ones we know about. Obviously, there are a lot of them who are not getting diagnosed. Assuming if you have 1 in 4 chance of getting cancer, you're probably talking more about 12 million of them who will eventually die of cancer if they do not get the treatment that they need, and some if they do. Anyway, so we want to build on it. People who should have the option of keeping that coverage if they want, also from choosing from private plans, individual private plans, if that's what they choose to do. I'd like them to have the quality of the services available to members of Congress. I know that when my husband was in the Senate, served on this committee, I was afforded very good coverage, which meant that although I had to be very afraid of having cancer, I didn't have to be afraid of not being insured. And also, I'd like to see us build on the on our public health system. You were talking earlier, Senator Murkowski, about Medicare and Medicaid and the need to make certain that these systems provide the kind of comprehensive coverage that we need to. So short of comprehensive insurance reform, we also need to make certain that we are bolstering those public health systems and the policies, the insurance that's available through those, and filling the gaps in eligibility and in screenings and other kind of coverage which currently exist in those systems. We know how to lengthen and improve the lives of people with cancer, but we've chosen as a nation to turn our backs on some of us who have the disease. I urge you to reform health care responsibly, morally, and aggressively, and save millions of us. Save that woman in Cleveland who whispered in my ear.